Responding to children's family violence risk. Children and young people require a unique response to family violence. They need to be recognised as victim survivors of family violence in their own right, whether they are directly targeted by a perpetrator or are exposed to violence and its impacts on their family. Children and young people do not have to be physically present during family violence to be affected by it. Exposure to violence includes hearing violence, being aware of violence or experiencing impacts on the primary caregiver, being used or blamed as a trigger for family violence. Children may not always tell someone about family violence, but there are presentations and behaviours that can alert you that they may be experiencing family violence or another type of harm. These are known as trauma indicators. Some examples include an infant may have an over or underreaction to loud noises or voices. A preschool-aged child may have difficulty playing with children their age. An adolescent may engage in risk-taking behaviours. If you observe indicators of trauma or are concerned that a child may be a victim survivor of family violence, consider your role, whether this is to screen for family violence, share your concerns with another professional, or undertake a family violence risk assessment. An assessment of family violence risk for children can be directly with the child or young person, with the parent or carer who is not using violence, and/or through information sharing with other services. The decision to do a risk assessment directly with the child or young person must consider whether it is safe, appropriate, and reasonable to do so. For further information, please see the MARAM Resources webpage.